My name is Nazir Ibrahim.
Okay, so I'm going to put my timer for your station. So 6 minutes for clinical examination and 3 minutes for summarization and cross question. Okay.
Okay,
The scenario is 60 years old gentleman named John examine his oral cavity for submandibular gland. Okay.
okay.
So that your time is begin from now. Start.
Hello. First, I wash my hand. Hello, I'm Dr. Nazir. I'm one of the surgical doctors for today. May I confirm your name and age, please?
Yes, doctor. I'm John. I'm a 60 years.
Nice to meet you, John. John, today I've been asked to examine your mouth inside the oral cavity. That would involve by looking and feeling your mouth. That would be okay with you?
Yes, doctor.
Okay, so can you please put off your gown, and I will look for your face now. So I will start by looking. Uh,
Mm,
so I will start looking for the swelling, the 6S, the site of the swelling, the surface, the skin overlying, the scars, the underlying muscle, and also I have to ask the patient where is the swelling,
mhm,
right side or in the left side. Also, I have to look for the inside of the mouth of the patient by using light source.
mhm,
And also, I have to examine the marginal mandibular nerve. So I will ask the patient, would you please show me your teeth?
Yes,
And
doctor.
yeah, would you please show me your teeth? That's great. And also, could you please stick your tongue out for me?
Yes, doctor.
Okay, so this is for the hypoglossal nerve.
Mm,
So thank you. Now I'm going to feel your gland.
mm,
So I will look for the swelling in your face, in your neck by rolling the swelling, and I will comment on the temperature by the dorsum of the hand, and the if there is a tenderness, and also temperature, tenderness, the pulsatility and the compressibility,
mm,
and the reducibility of the swelling.
mm,
Now, Mr. John, I will feel inside your mouth, so I will have to wear a gloves,
mhm,
and I will open look through the deep part of the duct by doing the bimanual palpation by inserting the index finger from inside
mm,
below the frenulum, and my left hand through rolling the gland from the outside. Now I also have to examine the lingual nerve, but I think the lingual nerve, I have to ask about the sensation. So
mm,
can you please, now I will examine the sensation of your tongue. So I will put, do you know this cotton wool? So
mm,
it feel like this, and I will put it in his, like in sternum or xiphoid process, and then I will put it on his tongue and ask him if he feel, you just say yes.
mm.
So now, would you mind if I examine you from the back?
No problem, doctor. You can.
So I will stand for the back of the patient. I will examine now I'm gonna examine the glands of your neck. So
Mm,
we'll do the submandibular glands, submental,
mm,
upper deep cervical, lower deep cervical, uh,
mm,
supraclavicular, occipital, posterior auricular.
mm.
So John, now I'm finished my examination. Thank you so much.
Thank you so much, doctor. Can you please summarize your case?
Mr. Today, I have examined Mr. John. He's a gentleman, 60 years old. So he's presenting with for the submandibular gland. So on inspection, there is it should be a normal or should be.
Normal, normal.
So on inspection, there is no swelling appear, and the by looking from inside, the duct is normal, and examining normal marginal mandibular nerve and the hypoglossal nerve, and by feeling there is no swelling and the normal lymph nodes. So my examination is normal for this patient.
So if there is a swelling inside the mouth, floor of the mouth, what should be your differential diagnosis?
My top differential diagnosis is cyrulophasis.
Mm? And
Uh,
then, would you
then
like to add anything?
And also, if there is any neoplasm, sublingual tumors or neoplasm.
Okay, how do you investigate this case?
I would like to do a cystoscopy, a cyelogram,
Hmm?
and X-ray.
Hmm?
And the cyelogram, it is like therapeutic and diagnostic.
Hmm?
You can see if there is a stone in the sublingual gland, or and can push out the stone by the contrast. That's what I remember now: cyelogram and the X-ray.
Okay, what would be your management if there's stone of this patient?
So I can do like first conservative by non-steroidals like massaging, like ice packs, or can do also the cyelogram because it can express the stone and push it, or surgically I can do sublingual gland excision.
Okay. Okay, nice. Do you know about marsupialization?
Mastibulization?
Hmm?
No.
Okay.
Okay.
Okay, nice. Thank you.
Thank you.
So I'm closing the timer. So let's review the station. So from very beginning. So you start with wash your hand, isn't it?
Yes.
Wash yourself, tell the patient. So it should be like when you are going to examine any oral cavity things, you should tell, I'd like to be very gentle with you. Okay, because no one is comfortable to handling inside the oral cavity. Okay, so
Okay.
because you'll get enough time for this station. So utilize these 6 minutes properly. Okay, so you check outside. The inspection is most important, from front, from side, from back. From front, from side, from back inspection. Within 30 seconds, you can check size, shape, any scar surface, any underlying skin condition, isn't it? Okay. Then inspection outside, finish. Inspection of oral cavity. How do you inspect the oral cavity? You can ask for a torchlight. So I'd like to check inside the oral cavity. So can you please give me a torchlight? The examiner maybe offer you a torchlight. And then you can use tongue depressor. You'll get a tongue depressor in. So before introduce your hand, before introduce torchlight, before introduce any tongue depressor, please be gentle with patient and tell that I'm going to introduce this tongue depressor. Don't put it without telling anything. That's wrong. Okay. So just be gentle. I'm going to introduce this tongue depressor into your mouth. Let me know if you feel any discomfort. If you feel any pain, I'm going to stop this. Okay. So it's a professionalism and communication. So there are 3 category mark. You, for your knowledge, for your examination, for your professionalism, for communication with patient. Okay. And then check the oral cavity. So which area you should check inside the oral cavity? So can you hear me?
Yeah, I'm with you.
Okay. So inside the oral cavity, you have to check oral hygiene first. The first thing, teeth alignment, oral hygiene, and then check 2 ducts, not only 1 duct. One is submandibular duct near the is touch the roof of the mouth by the tongue like this. So if you cannot understand your command, you just tell that like follow like this. Okay, and then check the duct submandibular as well as check the parotid duct, the upper second molar teeth, both parotid duct, both submandibular duct. Okay,
Okay.
why submandibular duct and parotid duct? 2 or 3 reasons. One is any redness of the duct, that means signs of inflammation. Any pus is coming out, or any obvious stone inside the duct. So the 3 point is important. Okay. And the next thing is, so it's a oral cavity inspection. You finish this. So you didn't touch anything inside the oral cavity. That's the just inspection. So inspection is finished. Outside inspection, outside oral cavity inspection. And then you can go for palpation part. So for palpation, without gloves, you can touch outside for temperature tenderness. Okay, for temperature tenderness as well as lymph node examination. Don't forget the lymph node. check from the back and side. Okay, and then you can offer that I'm going to introduce my hand into your mouth. I'm wearing gloves, so let me know if you feel any discomfort or pain. Okay, so and then wear the gloves, put your hand inside the mouth, check the duct, check the oral cavity, and bimanual examination. So one hand should be below and one finger should be floor of the mouth, and check any stone. So two side you have to check. So always remember, one hand, use one hand. Don't change your hand. Like you use your left hand here and again inside the mouth.
Yeah.
Left hand outside, just use your right hand inside the floor of the mouth or inside the oral cavity. Okay. So the bimanual examination, you finish that. The next thing is you have to check the sensation of tongue for lingual nerve. Don't use the cotton. Okay. So if you use the cotton hygienic thing, okay, use your finger by wearing gloves. So just command him, can you please stick out your tongue and close your eyes? I'm going to touch on the surface of your tongue. Let me know if you feel any sensation, okay? And say yes. So he closed his eyes, and then you use your finger and touch different area of the anterior surface of the tongue, and he say yes. That's the test for lingual nerve. Don't use cotton, okay? So that's how you maintain the oral hygiene.
Yeah,
So
yeah.
lingual nerve finish, oral cavity inside finish, and bimanual examination of gland finish, duct finish. So you close that segment, okay, with maintaining hygiene, and then remove the gloves. As well as you can check inspection part. I forget that two nerve, that the marginal mandibular nerve, show your teeth, marginal mandibular nerve, and for hypoglossal nerve, stick out your tongue or push this. You can do that. Okay. So three nerves, two duct. Most important duct is submandibular duct, obviously. One bimanual examination and lymph node examination. These are the checklist things and associated things, along with professionalism, communication, good understanding with patient. That's really important for this examination. So, and then you can examination part. For summarization, you can tell step by step. But for differential diagnosis, you should tell three differential. So what are the three differentials? So three differentials are: one, there may be chances of a stone, there may be chances of carcinoma or tumor. Okay, the two. What are the next one? Next one is submandibular lymph node enlargement. Okay, so why did you check the lymph node if it's not come to differential diagnosis? So you should tell submandibular lymphadenopathy. So three differential: submandibular pyelolithiasis, one is submandibular neoplasm, and another is submandibular lymph node enlargement. Three differential diagnoses you have to mention. And then comes to investigation. So don't go rush for investigation. I mean, don't go directly to endoscopy, pyelolithiasis. No. So start with bloods. Okay. So I'd like to check to rule out infection, blood, sets of blood, full blood count, electrolyte, LFT, CRP, and then you should tell that I'd like to check Ditch's cytology or culture and sensitivity of saliva is also important. And then you can tell facial X-ray, ultrasonogram, MRI, CT scan of face. This is also important. And then comes to interventional things: endoscopy, xylogram, diagnostic and therapeutic things. And finally, you have to mention must FNAC biopsy, any swelling. The last investigation should be FNAC biopsy. If you fail to mention that, so you lose your mark. Okay, you get my point. And then comes to management for stone. So for management of a stone, start with conservative. You did that conservative. And for surgical management, if it is stone, you can do that removal or endoscopy, or just an incision, remove the stone, let it marsupialization. Okay, just an incision, remove the stone, lay it down. The duct And for cancer tumor, don't do surgery by yourself. So tell it's a MDT approach, multidisciplinary team approach. Surgeon, maybe maxillofacial surgeon, general surgeon, you may involve on related team member. You have to mention. There's a part of surgery. So I think that covers all those things. But if there may be one question: what else you can do if there is repeated infection of the duct? So if there is repeated duct infection, you have to remove the duct. Okay, that's the answer.
Yes.
Thank you for your participation. Hopefully, you'll get some benefit from this discussion.
Thank you so much.